welcome to the second COVID313 Community Coalition for Families and Students Teletownhall. My name's Christine Bell. I'm a mother of 3 beautiful children, honored to serve as the Executive Director of Urban Neighborhood Initiatives, member of 482 Forward, and co-host for today's Town Hall. Last week, we had over 3,000 people try to join us. Unfortunately, we had some technical difficulties, which we spent the last 7 days working out. Big shout out to Detroit Public Television and helping us work that through. We are definitely stronger and smarter together. We are so excited that you've been able to join us, and we're going to get started in a few minutes. Today, we're translating the town hall in Spanish, Arabic, and ASL. So we want to give folks time to get on the right line and get comfortable. Cindy, please share the phone number to call for Spanish translation.
Si necesitas traducción en español, por favor hable al 313-626-7440. Hoy la señora Gloria Rosas y Liliana Torres harán la traducción. Otra vez, el número es 313-626-7440.
Thank you, Cindy. Saeed, please share the phone number to call for Arabic translation.
هاي اسمي سعيد دحدح. إذا تحتاجوا لأي شيء بترانزليشن للعربي فيكم تتصلوا على 313-241-7030. معكم سعيد دحدح من Empowered Childcare or Empowered Organization. So please feel free.
Thank you, Saeed. Katie, please share the instructions for ASL.
Thank you, Katie, and thank you, Christine. I am so delighted to welcome you to our second COVID313 Town Hall. And my name is Jametta Lilly. I'm blessed to serve as the CEO of the Detroit Parent Network. But before we start, we want to cover a couple little items. As Christine already said, we had a few technical glitches the last time, but we are so delighted DPTV has been with us. And just in case, however, we have a few glitches, stick with us. We really would appreciate that. I'd like to tell you a little bit about the coalition. And we want you to know they're just like you. We are all parents, we're organizers, we're change agents, we're warriors to make sure that there's a better way for all of our children. We represent over 25 organizations, community-based organizations, faith-based organizations, foundations, educators, and we've all come together because, like you, we are feeling the momentum and the uncharted weather that we are now going through in this thing called COVID. And so what we have done is pull together experts because we know what families need just like us. We need to have facts, we need information, we need resources, and we need that delivered by people who are competent leaders, who are compassionate, and make sure that we have what we need when we need it. The other thing that we like to tell you about the coalition is that we're feeling this moment with you. The reality is last week was a different Detroit than this week. Many of us are feeling the impact at work, in our own families, in this coalition family. We feel it. We are with you. But we also know that while they talk about Detroit being the epicenter for Michigan, which is really no genius thought because we are 3 times larger than the next city in the state of Michigan. But we also know that whether it's Detroit, New Orleans, rural Mississippi, or rural Minnesota, the reality is that the inadequate distribution of resources in the most wealthy country in the world is showing us now how terrible that is because the pandemic is taking advantage of exactly those health concerns and the lack of structure and competency that we need to meet this challenge. But we're here to let you know that Michigan is standing strong. We have competent and caring leaders, and this forum is all about us coming together every 2 weeks to make sure, again, that you're getting facts, that you're getting information, and that we're going to continue, Detroit. We're going to continue to stand strong, to love on one another, and absolutely, we're going to stay connected. Christine?
Yes, we want to make sure we're informed and connected. The town hall format will begin with comments from our caring experts in their area of expertise. Then you'll have a chance to ask questions. Soon we'll hear from Aisha Wells, paid family leave organizer of Mothering Justice, Nicole Sherrod Freeman, executive director of workforce development and Detroit at Work for the city of Detroit, Laura Lefevre, director of community projects, Children's Center of Wayne County, Nanette Wade, chief program officer, development centers, Alexis Wiley, chief of staff, city of Detroit, Portia Roberson, CEO of Focus Hope, Representative Rashida Tlaib, the representative of the 13th Congressional District, Senator Debbie Stabenow, U.S. Senator, Crystal Wilson, Assistant Superintendent of Communications, Detroit Public Schools Community District, and Dan Quisenberry, Executive Director of the Michigan Association of Public School Academies. Stay with us for the next 2 hours so you can get your questions answered and stay informed at a time when each day brings new information. We want to hear from you. Remember that. Please use the chat on Facebook or text your questions to 313-288-2082. Again, that number to text your questions to is 313-288-2082. We will have Q&A after each section. If we can't answer your questions today, we're committed to answering them by early next week. All of the questions asked today with their answers will be posted on COVID313.org. Cindy, please share the Spanish translation phone number for our folks that have just arrived.
Hola, si necesita traducción en español, por favor, hable al 313-626-7440. Otra vez, el número 313-626-7440.
Thank you, Cindy. Saeed, please share the number for the Arabic translation for the folks that have just arrived.
مرحبا، اسمي سعيد دحدح. إذا كنتوا بحاجة لأي translation لأي ترجمة باللغة العربية, please call 313-241-7030 بالعربي 313-241-7030. كل شيء بخص الترجمة بالعربية. Thank you.
Thank you, Saeed. Katie, please share the instructions for ASL for the folks that have just joined. To get us started today, let's welcome Arlisa Hurd.
Hello, everyone. My name is Arlisa Hurd, and I am a parent of 2 sons. One is an 8th grade student at the James and Grace Lee Boggs School in Detroit, and the other is an adult child. I am also an organizing member of 482 Forward, and my family and I reside in the Focus Hope neighborhood, which is also known as Hope Village. You know, since the COVID crisis, we have gotten to see who we are, not only as individuals, but who we are as a community. And that's why now more than ever, we need trusted resources and trusted information to help our students and families get what they need. Quite frankly, these are scary times, very, very scary times for most of us. This past week, many of us have seen loved ones become sick. Core members of our community have passed away. We've had family members passed away, including members of our school community. And this is a scary time. And now more than ever, we need to be there for one another. There are lots of questions, lots of concerns, and all kinds of information is coming from all different directions. Keeping up with the growing list of available resources, the latest school updates, or just trying to figure out where to get accurate health information has become quite a challenge. And that's why we've come together in a very, very big way. So today, we are so excited to have live participants on Detroit Public Television Facebook Live and onedetroitpbs.org/COVID-19. We want to be able to be a one-stop shop for you so you can get answers to your questions and to know we are all here for you and for each other. Now we'll turn it over to Cindy Gamboa. Cindy?
Hi, everybody. Welcome back to our weekly Teletown Hall. I am Cindy Gamboa. I'm a proud parent of 3 wonderful children and a Southwest Detroit resident. I also have the honor of serving as the community organizing director for Detroit Hispanic Development Corporation. I'm here to remind you guys of, who we are. COVID313 Community Coalition for Families and Students, formed because a group of over 25 organizations, community members, parent leaders, faith-based organization leaders, wanted to ensure that everyone has regular information on what's happening, because we know things happen, things change on a daily basis. So the organizations and members include the Congress of Communities, Mothering Justice, Detroit Parent Network, Detroit Hispanic Development Corporation, My Students Dream, 482 Forward, Urban Neighborhood Initiatives, Brightmore Alliance, Focus Hope, Hope Starts Here, Developing Kids, Total Life Christian Ministries, The Village PCL, Skillman Foundation, Brilliant Detroit, Detroit Public Television, Detroit Community Education Commission, Detroit Action, United Way for Southeastern Michigan, Michigan Association of Charter School Authorizers, and the Detroit Public Schools Community District. We have representatives and leaders from each one of these organizations on the call today. Leaders, would you mind turning on your video so the public can see you? Thank you so much. So we're going to continue our commitment that we made to you last week. There was 2 commitments that the COVID313 Coalition will continue to deliver on. First is that we will continue to have these live teletown halls every Thursday from 12 to 2 to bring you the most up-to-date information from experts on topics that you are most interested on. The second is that we're going to continue to coordinate all of the resources that we come across on one site, that is COVID313.org. If you haven't visited the site, please go there and explore that once you're done here today. Now, we just heard an announcement from our governor of the closure of all K-12 schools in Michigan. We know that there's a lot of questions that are going through your heads right now. So we wanted to invite you to tune into the governor's town hall meeting tonight at 7 for more details on how that's going to affect families and students in Michigan. We're going to give directions at the end of this call, so please make sure to listen for that on how you can make sure to join this important town hall. Right now, we will, soon we're going to go ahead and hear from experts today on what is happening, any updates this week. The experts that we have on the call today that will give updates are Aisha Wells, paid family leave organizer of Mothering Justice, Nicole Sherrard-Freeman, executive director of workforce development and Detroit at Work for the City of Detroit, Laura Lefevre, director of community projects, Children of Wayne County, Nanette Wade, chief program officer of development centers, Alexis Wiley, chief of staff for the City of Detroit, Portia Roberson, the CEO of Focus Hope, Representative Rashida Tlaib, representative in the U.S. Congress, Debbie Stabenow is a U.S. Senator, Crystal Wilson, Assistant Superintendent of Communications for the Detroit Public Schools Community District. Dan Quisenberry, Executive Director of the Michigan Association of Public Schools Academies. They will be speaking from 12 to 2, and we're gonna have Q&A sessions throughout the segment. Before we begin, we're gonna have Arlisa share a few important information. Arlisa?
Thank you, Cindy. Hi. So once again, I just want to go through some quick tips and some quick instructions to help make your listening and viewing more pleasurable. So if you are on Facebook Live, we have chat moderators that will answer questions, and they will post questions on the Zoom for our panelists to answer. If you are watching from onedetroitpbs.org/COVID-19, you can text us questions to 313-282-2082. Again, you could text those questions to 313-288-2082. Now, here are a few rules for the chat on Facebook. So the group rules are: please keep the discussion around each and every topic respectful and civil. That means no foul language, no trolling. Please keep to the topic of discussion. There will be designated times for Q&A or questions and answers, where other related topics and questions can be discussed. Remember, no post with graphic or disturbing photos, videos, or other media. If you comment or post in the discussion, we ask that you try to add something unique or original to the conversation in order to be respectful of all participants and to help those monitoring the discussion. Absolutely no promotions or sales pitches of any kind. If you have something to donate and it's directly related to the discussion, you can share that information in the chat. Also, we as group administrators reserve the right to remove or block someone from the live feed for violating these policies, or at our discretion for any reason and at any time. And for those of you participating via Facebook Live, please keep Facebook's community standards and terms and policies in mind. We are committed as a group to posting the answer to questions that aren't answered early next week on our partner Facebooks. And we will also post a live recording of this on COVID313.org. If you would like to sign up for regular updates and to get reminders from our group, please sign up by filling out the form in the chat on Facebook or texting your email to 313-288-2082. And again, texting that information to 313-288-2082. And for those of you who have just joined us, I will have Cindy, Najwa, and Katie tell us again how to connect you if you are a Spanish, Arabic speaker, or need ASL interpretation. Cindy, can you please share the number for Spanish translation one more time?
Si necesita traducción en español, por favor, hable al 313-626-7440. Otra vez el número 313-626-7440.
Thank you, Cindy. And Syed, can you please share the number for the Arabic translation for folks that have just arrived?
مرحبا. إذا كنت بحاجة إلى الترجمة للغة العربية نرجو الاتصال على الرقم 313-241-7030. Again, الرقم هو 313-241-7030. Thank you.
And Katie, for ASL. All right, thank you. So now I will turn it over to our moderators, Christine Bell and Jametta Lilly.
Sorry, I was muted. This is not perfect. Thanks, Arlisa. We're so grateful for our expert panelists that could join us today. We've asked them to share with us 3 to 5 of the most important pieces of information that families and students need to know right now so that they can provide some peace of mind during this very unsettling time. For our experts, please remember to speak slowly for our translators. They want to make sure that they are translating the important information that you are providing correctly. You will have 5 minutes to share. Terry Whitfield will chat you your remaining time. And if you go over your 5 minutes, I will gently remind you to wrap up. We will be taking questions from our guests, and at the end of your sections, we will be asking those questions. Jametta?
Yes, thank you, Christine. So we're continuing our approach, which is to try to be holistic in the information that we present to you. So in that same context, we are having presenters from health and mental health, because the reality is for us to be healthy, we can't separate our body from our mind. And certainly with this virus, while it may be impacting our bodies, but we absolutely know that we have to think about and attend to our social, emotional, as well as our mental health. So in this segment, I'm so delighted again to bring back Crystal Hepburn, who is the team leader for the Children's Special Healthcare Services at the Detroit Department of Health. Crystal, welcome.
Hi, good afternoon, and thank you so much for allowing me to join you once again. I would like to go ahead and start by reaffirming that the Detroit Health Department's #1 goal and focus is to keep residents healthy and safe. Currently in Detroit, we have had 2,483 confirmed cases of COVID-19 as of April 1st. Unfortunately, there also has been 82 confirmed deaths. Across Michigan, our current numbers are 9,334 confirmed cases of COVID-19 with 337 confirmed deaths.
Crystal, I'm sorry to interrupt. Could you speak a little bit louder? We're having a hard time hearing you. Thank you.
Okay, sorry, I was trying to go slow.
Yeah.
Okay, I will re-speak the phone numbers or the current number. So in Detroit, we currently have 2,483 confirmed cases of COVID-19 and unfortunately 82 confirmed deaths. Currently across Michigan, we have 9,334 confirmed cases and 337 confirmed deaths. We have been receiving many questions in regards to testing. So I will start with this information first. Regionally, the city of Detroit, Wayne County, Oakland County, and Macomb, along with many health systems, have partnered for a drive-through COVID-19 testing site. This testing site is located at the state fairgrounds. The testing is available Monday to Saturday, 7 a.m. to 6 p.m. Appointments are required to be made. Individuals will need to see their doctor to obtain a doctor's order. Then they would be required to call 313-230-0505 to schedule their drive-through appointment. The city of Detroit also recognizes transportation may be a barrier for some individuals. The city of Detroit is providing complimentary transportation to residents who have a COVID-19 related healthcare visit. So if this is going to your doctor to have the screening and confirmation of your symptoms, or to obtain the doctor's prescription to then have the testing completed at the state fairgrounds. The phone number for complimentary transportation related to these health issues is 208-7364. This line is also available 24 hours, 7 days a week. We do receive other questions in regards to what if I don't have a doctor? If individuals do not have a doctor, the City of Detroit has partnered with some federally qualified health centers to provide complimentary exams. If you would like to have additional information due to the short time to speak, you can call the City of Detroit's hotline at 313-876-4000. Press number 1. They would be able to provide you with options based on your district. If you do have a provider, you can go ahead and contact them. You're going to then call 313-230-0505 to arrange your appointment at the testing site. In regards to,
Crystal, could you provide the address for the state fairgrounds?
The state fairgrounds is on State Fair in Woodward. I don't have the exact number of the location offhand. I could go ahead and put it in the chat box once I'm done, so individuals would be able to see that if that's okay.
That's great. And can you also repeat the last number that you gave for people to call if they have questions?
Sure.
Thank
The
you.
Detroit Health Department's COVID-19 hotline is 313-876-4000. Press number 1. That phone line is monitored 24 hours a day, 7 days a week. If individuals have specific questions, you can also email DHDOUTBREAK@detroitmi.gov. So it's outbreak@detroitmi.gov. I will send that information as well. Thank you.
Thank you.
Crystal, thank you so very much. And we know how critical it is for us to get health data from our public officials, but trusted sources. And to continue thinking about trusted sources, we are so delighted to have someone both from children's services as well as adult services with mental health, 2 of our stellar mental health organizations. First will be Laura Lefevre. Laura is the Director for Community Projects with Children's Center of Wayne County. Welcome, Laura.
Hi, Jametta. Good morning, everyone, or should I say good afternoon. I'm going to share my time with my colleague, but first I'd like to say that this is such a critical time, and I want everyone listening in to know that our mental health, as what was indicated earlier, is just as important as our physical health. And right now, during these challenging times, our mental health can really be stretched and stressed. But I want everyone to know that mental health services are here in Detroit, Wayne County. Service providers such as the Children's Center are doing telehealth services to existing clients, and we're working to get new clients virtually in the door every day. So with that said, Crystal Coleman, are you on? I want to share my time. Crystal Coleman is one of our clinical directors at the Children's Center, and we know our children, they are some of our most vulnerable populations that we service. It is critical that we make sure we meet their mental health needs. Crystal?
Hello?
Yes, Crystal, we can hear you. Please go ahead.
All right, so thank you for having us as a part of this. We absolutely understand the struggles and challenges that our families are having, because we are having them as well. So a couple of things that I would like to point out is, number one, If you have been participating in mental health services prior to COVID-19, it is critical that you continue those services. This is a stressful time for everyone. Children are at home. Parents are now home trying to work and figure things out in this new environment. That's a huge stressor that I've been hearing from a lot of our staff. So one is if you were already participating in services and you're now being given the option to participate in telemedicine services, which is completely new to our world, I know. But we're thankful that we were able to pull things together quickly so that families would still continue to have access to those services. So please reach out to your provider that you were engaged with so that you can continue those services. Second, but connected, we really do want you all to sort of pay attention to what's going on in your home. You need to try to establish a new schedule that will work for your family, as difficult as that may seem. Get some separation time so that children can do what children do, and also do some things, so that parents can have their alone time as well. We've had to work with some of our staff with giving them more flexible schedules. If you need to start early in the day, take a break during midday when you're going to be really involved with your children, get back to work more in the afternoon and evening, then you need to consider those things for yourself at that time. The other thing I would like to point out is that we've seen a lot of articles, and we know it to be true, that when families are in the home for longer periods of time, because we see it over the summertime and holiday seasons as well, that there's an increase in stress and tension, and the dynamics sort of shift. So we want people to be mindful and look out for signs of stress, because that could increase instances of abuse amongst the adults in the home as well as the children. So it's going to be very, very important for you to utilize your sources of support right now. Lastly, if you were not already connected to a service agency prior to COVID-19, you're looking to get engaged, particularly in my case for children's services, you could reach out to a community mental health agency in your neighborhood. And if you're not familiar with who those are, you can also still contact the Wayne County Access Center at 1-800-241-4949. There you will be able to gain access to services for children, for adults, for substance abuse, and additional resources like domestic violence and additional basic needs, foods, and all of that. So please reach out to your support systems that already exist, and also reach out to the Access Center if there's additional needs. Again, that number is 1-800-241-4949.
Crystal and Laura, thank you so very much. And if you need to have more questions, we'll have an opportunity. But now we're going to shift. Thank you for sharing about children and youth to Nanette Wade, who is the Chief Program Officer at Development Centers, to talk about adult services. Nanette.
Good afternoon, everyone. Can you hear me?
Yes, we can. Thank you.
Thank you very much, Amy, for the opportunity to share with the COVID313 team. I just want to piggyback and share a little bit more on what Crystal and Ms. Leviver has shared. Working with the adult population, dealing with behavioral health and mental health, we know the challenge is often that we say that they suffer in silence with behavioral health and mental health issues. At this point in our environment, we now know that they're not only suffering in silence, but they're also suffering in isolation. And so I do want to stress, again, the importance of us reaching out to our neighbors. It's funny, my mother lives by herself, and so her great granddaughter called and said, "Mom, they said, Gigi, they said for us to call everyone that live alone." And so I thought about that, and I said, especially for our single adults, it's really, really important that as a community that we identify who our single neighbors are and reach out and talk with them. I was a little taken aback at the news report that the increase of sales of alcohol and marijuana has more than doubled, and in some cases tripled. And in looking at the sales of alcohol, we talk about addiction, we talk about abuse, we look at domestic violence and gambling and all of those things that sometimes happen as a result of individuals' increased stress or not necessarily knowing where to go to get help. I too wanted to ensure that everyone had the number to Detroit Wayne Integrated Health Network. They're our hub in terms of substance abuse, behavioral health, as well as other types of treatment. If you missed the number was 1-800-241-4949. That number will allow us to access behavioral health in your local community. It'll also gain you access to substance abuse treatment, as well as other needs that you may have. I also wanted to share a couple national hotlines. The suicide hotline is 1-800-273-8255. Again, the suicide hotline is 1-800-273-8255. The domestic violence national hotline is 1-800-799-7223. Again, 1-800-799-7223. And I thought that was important because as families are spending more time together, not having access to recreation and going to work and those things, tensions reign a little high sometimes. And we want to make sure that we as a community, we talk about it take a village to raise a child. Well, it's going to take a village in order for us to get through this crisis. And I think it's really important that we are provided we are equipped with the tools that our neighbors, our families, our friends would need in order to help them also get through the crisis. I also wanted to share the gambling hotline for Michigan. That's 1-800-270-7117. Again, 1-800-270-7117.
Nanette, thank you so very much. And all of the telephone numbers and the critical links and information that both our health partner and mental health partners have provided, we'll make sure that information is available to you as well. And so what we have to do is actually transition to our next important segment. But we do want to let you know that we want to hear your questions. You can use the Facebook. You can go to 313-288-2082, or you can also put your information in a chat. So at this point, we're going to make a transition. Thank you so much for health, but also critical in this timeline is what is happening with the important issue of employment and what are the resources that, in fact, we need to address that. So we're very pleased to have with us Nicole Sherrod-Freeman, who is the Executive Director of Workforce Development and Detroit at Work at the City of Detroit. Nicole.
Thanks so much, Jametta and Christine, and to COVID313.org leadership for pulling this call together. I'm pleased to join my fellow panelists and our elected officials, Senator Stabenow and Representative Tlaib. I want to update you on 4 topics briefly, and there's a lot of ground to cover, so I'm delighted that the materials that I'll share today via a PDF, I hope that's coming up shortly, are about Detroit at Work, Grow Detroit's Young Talent, unemployment insurance, and then how we're supporting our small businesses at this time. So the first topic I want to talk through with you is what's happening with Detroit at Work. So you may know that there are Detroit at Work career centers all across the city. There's one in every district. Those centers have now moved to online and by phone service during the time that we're under the executive order to stay at home. So if you are looking for a new job, if you'd like help with your resume, if you need help with interview skills, if you want to talk about your career track and what careers might be right for you, you can reach us online at detroitatwork.com, or you can call us at 313-962-WORK. Again, that's 313-962-9675. If you saw the mayor's press conference yesterday at 3 o'clock, he and I talked about a new initiative through Detroit at Work called Ready to Hire. And so while it can be tough to think about your next job or a new job during these times, we want you to know that Detroit at Work and the city have partnered with more than 35 employers so far across the metro area. And there are more than 1,100 jobs that we're trying to fill. So companies like Henry Ford Health Systems on the Boulevard, they need CNAs and environmental services techs and patient transport folks, not to mention LPNs and RNs. There are delivery driver positions, grocers and drugstores like Meijer and CVS and small markets. Go to DetroitAtWork.com and we can help match you with the opportunity that's right for you. The next topic that I want to cover is unemployment insurance assistance. And this is a lot to take in. So I will just say to you that these materials will be available on the website. To file for unemployment, this is not our usual area of work, but to file for unemployment, you just need to go to michigan.gov/UIA or call the phone number for UIA, which is 866-500-0017. Also part of this topic is there is a filing schedule for unemployment insurance, which is on the next slide, which will help you see the best time to call based on what your last name is. So if you call during a time that's not aligned with this filing schedule, they'll still take care of you, but the Unemployment Insurance Agency is asking you to please adhere to this filing guideline. A word about Grow Detroit's Young Talent. Every year, we support more than 8,000 kids getting a summer experience between the ages of 14 and 24. We want you to know that GDYT is still on. We are working with DPSCD to ensure that it's linked to academics where possible. These will still be paid summer experiences. They'll be available online if we're not back in the swing yet, and you'll hear more about that in the coming days and weeks. And then the last topic I'll update you on is what we're doing to support our small business community. If you own a small business, we are trying to make resources available to you both through the Detroit Economic Growth Corporation and through Detroit at Work. So I'll just leave you with this slide and my phone number, which is on the next slide. If you are a small business and you need help with cash flow, hiring, you can text me at 313-319-5831. Again, that's 313-319-5831. Thanks again to the COVID313 team for this opportunity.
Nicole, could you share one more time the unemployment number, please?
Yes, it's 866-500-0017.
Thank you so much.
Okay, again, thank you, Nicole. And to continue our focus on employment, which is this critical area, we are also delighted to have one of the long-standing organizations that's been about economic mobility and training, and that is the Focus Hope. We're so delighted to be joined by Portia Robertson, the CEO. Portia.
Thank you so much. I hope you guys can hear me.
Yes, we can.
Great. Thank you for having me. I really appreciate this. This is an excellent opportunity for us to get out more information about what we are doing, what we've been doing, and what we continue to do in the face of COVID-19. We did immediately start to train many of our students in online. So one of the things we thought was really important is as many students that we could train that were already in a number of our programs, we tried to shift to online, and we're continuing to look for ways in which we can increase that training in different areas. So what we are really looking at right now is how we maintain and make sure that as jobs come back, as employment comes back, people are ready for those jobs. We know that people are going to have a lot of issues surrounding unemployment and being laid off right now. And we want to ensure that as soon as our economy starts to pick up again, we are making sure that people can get involved in that again and get employment again. But one of the issues that is important to us, because we also do Head Start and Early Head Start, is the governor's announcement today, because we know that no matter how important or how much we train somebody for a job, childcare is an issue. So we're looking at ways in which we're going to change our Head Start programs, see if we can manage to do some programs that will allow some of the people who are in our training programs or who may be able to get employment through many of the things that Nicole spoke about, whether they will be able to come into our Focus Hope area for daycare and for Head Start programming. So that's one of the issues that we have been tackling and started tackling almost immediately. You know, we work with working families all the time, and nobody could have prepared for this. I often have said in the last 2 weeks, who knew that I would be dealing with some of these issues? But I think what we're really trying to do strategically at Focus Hope is make sure that people are still continuing to get some of the services that they need across the board, across the family. You know, we immediately went to a drive-through pickup for our seniors. So I know I'm supposed to be talking a little bit about workforce, but I really want to make sure that people know that Focus Hope is still there to provide food for seniors who need it. And all you have to do is call us. I want to give you a number for that. It's 313-494-4600. We make the application process very, very simple. There's not a lot of information you have to give to us. You can pick it up from us and we'll put a box of food in your car, or we'll come out to your home and deliver it to you if you're at home. And that can help with caregivers and other family members who are taking care of seniors, who are checking in on seniors. You know, we had partnered with the Children's Center some time ago. So for some of our students who unfortunately have lost their parents due to COVID-19, we're making sure that there are mental health opportunities for them to talk to somebody, not only for our children, but also for students who know people who have passed away from this horrible pandemic. And so we want to make sure that we are addressing not only the workforce part of it and getting people back to work when the time is right, but all the other issues that surround that. And so I just really want to encourage people to reach out to organizations, not just Focus Hope, because there are a lot of organizations still trying to get this work done, but certainly Focus Hope is one of them. And so we are still somewhat open for business. We're trying to convert as much as we can to make sure that our communities are ready to go back to work when the time is right. I would say the other thing that we started to talk about is even when we start talking about people going back to work, it is important for us at Focus Hope to make sure that they're going back to safe working environments, right? So that's something that we started to talk about and really have conversations with folks about whether or not, you know, yes, there's a childcare issue and where they're going to leave their children if they go to work for you, but also how long are we going to need to be social distancing? Our company is going to really look at how they prepare for employees to come back to work, because the last thing we want to do at Focus Hope is, you know, train somebody and find a great job for them, but send them into an environment that's not safe for them. We do not want to promote that whatsoever. So we're looking at that not only at what I do at Focus Hope, but also with some of the organizations we work with to employ people. And so again, I just encourage people to call us. If we can reach out to you, we've been providing diapers and wipes and formula for families, for mothers who may not have had that or who may have gotten laid off, who normally didn't expect to have their children at home with them all day. And so they may need a little additional help. And so I just, again, encourage you to call us 313-494-4600 to make sure that we can do whatever we can to help assist the entire family. And I thank you all for letting me join you all on this call and with the coalition.
Portia, that was phenomenal. And I think that as people are listening, you're feeling heartened because you're hearing support and you're hearing it from experts who have leadership and competency to make sure that we're getting what we need. And thank you also for lifting up about grief counseling. That's one of the very important things that we encourage you families to reach out to Children's Center. They've been doing this work for years, and so have folks in the adult mental health side of things.
Absolutely.
So let's continue. Thank you for bringing that up. And let's continue to talk about and have an understanding of what's going on with employment. And to help us talk about paid family leave, we are delighted to be able to have Aisha Wells, who is the organizer for paid family leave from Mothering Justice, to join us. Aisha.
Thank you, Jametta, and also thank you to 482 Forward, the COVID313, Detroit Public Television, and to all of our other partners for having me here today. I work for an organization, again, called Mother and Justice. We're a grassroots organization, and we're based out of Detroit, Michigan. We advocate for mothers of color by changing policy for federally and locally for economic equality. We have a mama's agenda, and it focuses on what mamas want and what they need. If you have additional questions after this presentation on paid family and sick leave, you can text mama's agenda to 56525. But I will do my best to answer as many questions as you all may have today. Two major laws were passed in Michigan in March 2020, federally, to support people affected by the COVID-19 public health emergency. The first mandated paid sick days and paid family leave in some COVID-19 related situations. The second mandates significant unemployment benefits for workers. There is a difference between paid sick days and paid family days, paid family leave. Sick days are days that you work to care for, say, if you get the flu, if you need to see your doctor for a checkup, or if you need to recover from a cold. Family leave is a little bit longer. It's for long-term illnesses where you will need to be out to recover and help your loved ones. The Families First Coronavirus Response Act that was passed by Congress, it was passed on March 18th, 2020. That included paid sick time and paid family leave to work together. I will talk to you today about Michigan's paid sick leave and the unemployment provisions. And I know Nicole just spoke a little bit about it, but I'll talk just additionally on that as well. Michigan paid sick leave law, as it stands right now in Michigan, you can receive paid sick days under the current law. If your business has 50 or more employees, if you are caring for your health needs and the health needs of your family, you are, or your work or your child's place of care is closed for public health emergencies. Health authorities determine your family member could jeopardize the health of others in the community, or for reasons related to domestic violence or sexual assault. And this again includes family members, including your child, your spouse, your parent, your parents-in-law, your grandparents, your grandchild, or your siblings. The way that you incur this is you get 1 hour for every 35 hours worked, and you get up to 40 hours per year. And you get this at the full wage amount. Employees must follow the employer's usual normal notice procedures and documentation requirements. If you qualify for Michigan paid leave, you can follow the federal law first, and then the Michigan law comes into play. These laws are protected under the anti-discrimination and anti-retaliation laws. Michigan paid sick days are paid for by the employer. So this is between the employee and the employer. And if you feel like your employer is violating the Paid Family Leave Act for Michigan, you can file a claim at www.michigan.gov/wage claims. The Federal Family and Medical Leave Act is for serious illnesses. People who are covered under this provision are private sector employees with 500 or fewer employees, including all government agencies and all K-2 through 12 schools employees. This is also used for birth, adoption, or foster placement of a child, to care for a spouse, or to care for a parent who has a serious health condition, and then the serious health condition is yourself, and you can't do your essential parts of your job. Any qualifying military people that have to leave urgently are also covered. Again, this is for families who are sick. For example, if I needed to care for my dad. And again, this is used for your child, your spouse, your parent. This leave is up to 12 weeks. Under the Families First Coronavirus Response Act, if you are caring for your child whose school or childcare is closed due to coronavirus, The first 10 days may be unpaid. These days can be combined with paid sick days or other leave. After 10 days, the employer must pay the worker 2/3 wages. That's up to $200 a day or $10,000 total, and then for up to 10 additional weeks. This law is also covered under anti-discrimination and anti-retaliation laws. People who are not covered. If you work at an employer who has 500 or more employees, and that includes most federal workers as well. And an example of that would be like your Walmarts, your Amazons, your large corporations. They won't fall under the Families First Coronavirus Response Act. The other individuals who are not included are health emergency response employers may opt out of it. And if your organization has 50 or fewer employees, you can request an exemption from the Department of Labor. The last bucket I want to talk about is unemployment insurance, which again, Nicole talked about already. This law was passed on March 27th, and it's called the CARES Act. It also has a very long name. It's called the Coronavirus Aid, Relief, and Economic Security Act. This has 3 different buckets as well. You can fall under the pandemic unemployment compensation, the pandemic emergency unemployment compensation, or the pandemic unemployment assistance program. These are all federally funded programs, unlike the pay sick, which is between the employee and the employer. So I want to make that clear as well. States will receive additional administrative funds to operate these programs, but I will let Senator Stabenow, I know she's talking more about federal things, so I will allow her to speak about that as well. The way that Michigan will manage these programs and our role in this is that we will manage the applications. We will give the maximum benefit of $362 to those who qualify, and you would also receive the $600 for those who qualify as well, in addition to the maximum. All in all, at Mother and Justice, we will continue to fight for the help from the governor and the attorney general so that mamas who were left out of these laws, because there are a lot of mamas who were still left out, we want them to know that they're important and they should be able to care for themselves or their family members during this pandemic as well.
Aisha, thank you so much for your strong advocacy and that obviously of mothering justice. We do have a few questions that we need to try to squeeze in about 3 minutes so we can continue to move forward with the experts that are in the next segment. Christine, I believe we have a few.
Yep. So I'm going to start with Portia. If you could, in 30 seconds, tell us about the days that the diaper giveaways, the days that they're happening, and the pickup time and locations, and also the food pickup.
Okay.
Days, times.
So food, let me start with food first, because we just started on diapers, wipes, and formulas, and we plan to do that. We did it Tuesday. We're going to do it on Thursday, and then I will get additional times and dates for you. I think we're looking at Tuesdays and Thursdays of every week, which would be at our Children's Center on Oakland Boulevard. I'm always managing how much we have because I want to make sure we have enough. But we just started that this week. We were able to secure enough to go out and get some, and we want to continue to do that going forward because we know the need is there. Our food program is 8 to 4, Monday through Thursday, and 8 to 12 on Fridays. And again, if you call us, we can give you the information about when you can pick up diapers, formulas, and wipes, and also information on what you need to do for our program for food for seniors.
Great, thank you.
No problem.
Nicole, this question is for you. For GDYT, how will students be able to get their work permits if schools are closed?
Oh,
this is a great question.
Great question. It's a great question. So, so I am in regular contact with Alicia Merriweather, who is Deputy Superintendent of DPSCD. As you might imagine, she is really consumed with the academic side of things right now, but she and I meet at least weekly, sometimes more often than that. and that is on our agenda. So in partnership with DPSCD and our philanthropic partners like Skillman Foundation and others, we'll be working through these details in the coming days and sharing information.
Great, thank you, Nicole. Aisha, we've got a couple of questions for you. The first is, how do the laws affect contract workers? Are there provisions in the law for contract workers?
So they created a bucket for pandemic unemployment assistance. That is for anybody who is a non-traditional worker. So if you're a contractor, if you are if you work part-time, if you work gig jobs, you will fall under that. So the answer to your question is yes, there is a provision for people who have non-traditional work history.
Great. And then how does it work for essential employees such as bank employees? Will he or she or they be eligible for unemployment if he, she, or they has childcare issues? What is their recourse?
That's a sticky issue right now for essential workers. If you have an organization that that is an essential worker, honestly, the only way to be able to fall under that bracket is if you do have a child, there is a way to file for unemployment, but you have to be furloughed or on voluntary time off in order to be able to receive those benefits. We all have been doing some digging around that. Some of the provisions are kind of unclear. If you want to send us your email or your name, then I can follow up with you to see if bank employees will fall under the essential workers. But for individuals who have to end up staying home, some people have been able to file for unemployment, but that's not being attached to your employer. So please give us your name so I can follow up with you after.
Thank you. Jametta?
Yes, thank you so much for those questions. And now we're going to shift to a very important segment, and that is to hear from both our governmental and legislative leaders. So if there's anything that we know at this point in time in history, having competent, caring leadership matters. And we are so lucky, we're blessed in Michigan that that's what we have, both at the state level and locally. So to begin our conversation about resources that the government can provide for us is Alexis Riley from the mayor's office. Alexis, welcome.
Hi, how are you? Can you guys see me?
Alexis, we can't see you, but we do hear your wonderful. Now we
hello.
Can. Great.
Hi.
Hello. Chief of Staff, Alexis Wiley.
It's so nice to be on. This has been a really great conversation, a really critical one in this tough time. As you know, we have been working really, really hard to make sure that we are making sure that we're taking care of families right now, our seniors, our citizens, because we know that it's absolutely critical that we all get through this together. As you know, the areas that we've been focused very greatly on is one, testing. That is something that has been a big issue because a lot of people, we know that in order to get in front of this, we have to make sure that people are getting tested. So the city on March 27th launched the drive-through testing sites at the state fairgrounds. We have been seeing 700 people a day every day since then. We run Monday through Saturday, 9 to 6:30. And our focus is to make sure that we're getting people through so that they have access to testing. One of the things we've been doing every day since we opened was identifying barriers that we need to eliminate to make it easier for people to get access to tests. One of the big things that we actually heard a lot about was that people were, of course, concerned that one, maybe they didn't have health insurance, or maybe they didn't have a primary care physician, or even their primary care physician was not answering the phone. So we knew that was a barrier that we needed to eliminate. So what we did was providers from across, we've identified primary care providers across the city, and we now have a listing on the city's website where you can go and find a primary care provider who's accepting patients uninsured and insured, so that you can get a prescription in case you need a test for COVID-19. It's a very efficient system. We've been running it again since the 27th. The other barrier that we've been trying to make sure that we're eliminating is transportation. And we know that in Detroit, a lot of people don't have access to vehicles. So we have been we've been working on identifying providers who can take people into the fairgrounds to be tested, regardless of how much money they have. We're making sure that cost is not going to be a barrier, and we're going to be early as tomorrow. So that's one of the big things that we've been focused on. We've also been focused on making sure, and for one, you can find all of this information on the city's website at detroitmi.gov. We have very, very clear links to that information. So we've been working around the clock, trying to make sure that we're moving through all of this. The other thing that we've been doing is making sure that we're supplementing the food system for families. Right now, we are serving food for children and families at a number of our recreation centers across the city. Again, every center and their hours are on the city's website. We want to make sure that people know that they can rely on us. Whether you need access to tests, whether you need access to food for your family, you can turn to the city for help. And all the great partners like 482 Forward, I thank you so much for taking the time to have these important conversations. I've been in touch with your team throughout this, and I think just the value of connecting families to the information they need is invaluable in a time like this, where it seems like every day there's something new happening. There's a new change, and it's incumbent upon all of us to make sure that we're all prepared and taken care of.
Alexis, thank you so much. Those were important resources to hear. And just as important is to hear the voice of our local leaders speaking to issues and concerns that we have. And so continuing that, we're going to move it to now hearing from our national leadership, folks who have integrity and leadership skills to bring to the table, and so important information and support. So with that, I'd like to ask you to join in welcoming Representative Rashida Tlaib, who is a member of the United States Congress. Representative Tlaib.
Hi, thank you all so much for doing this. I am also learning about some of the incredible work that all of the coalition members are doing. I'm so proud of what I heard that Focus Hope is doing, Portia, and some of the incredible outreach that you all are doing. The fact that this is a bilingual, my first, I've been on a lot of Zoom calls. I just want you to be all proud. This is my first bilingual Zoom participating in whatever we call virtual telephone town hall that included so many people, included those that may be hearing impaired. I want to talk.
Hey, I'm so sorry. I'm about to call back in.
I want to talk a little bit about some of the things that we're getting a lot of calls in my office about is the direct payments. And these are the $1,200 that a lot of folks are talking about. So know that the first round of checks will be in the first week of April 13th. Again, that's only just the first round. You talk about millions of people. I already saw a figure of showing about 6 million folks, though, that have already applied for unemployment benefits across the country. So we know folks are in need of this extra amount of money, again, direct payments. So you know that if you make less than $75,000, you qualify for the $1,200 with an additional $500 payment per minor child. The payments do decrease or stop altogether right at $99,000. But again, for folks that are married, it goes up to $150,000 if you make combined less than, and that's a lot of our folks that we serve and a lot of folks that are listening in. So you do qualify. Now, please know the struggle now is the process. You know, what we've done is pretty extraordinary in Congress in a bipartisan way. I do think it should be much more aggressive in doing more reoccurring payment options and also allowing the use of debit cards, similar to what we do for food assistance for folks, because if folks are not qualified to file for federal taxes, which is a lot of folks on disability income, low-income folks, that is not taxable income, as you all know. I'm going to slow down, sorry. I want you to know that it isn't just simple to apply online, right? I mean, this is not as accessible as we wanted it to be. But if you do get SSA and you're a senior you will automatically get the payment, so you do not have to fill out the form. However, if you are someone that's low income or don't qualify to fill out a federal income tax form, which is a lot of residents in my district, we do, now they are IRS requiring, we're still fighting them on it, requiring in their guidelines that they fill out a payment or some sort of form, which I believe is going to be a zeroing out like federal tax form to be able to get it. Because there are so many of our residents that are unbanked and don't have direct deposit, that means longer wait period. I signed a letter with Congressman Kildee saying that that should be the opposite. Those that are probably unbanked are the most vulnerable, lower income, should get their checks first. And so we've been pushing back on that because now IRS is saying it could take up to 10 weeks or more for those that don't have direct deposit options. Again, please know that I know Senator Stabenow and many of us on the federal level are pushing for a much easier process for folks. I know personally I have been pushing one for reoccurring payments because I know one time is just not enough. We all know it isn't, especially because we needed that 2 weeks ago. And you see countries like Canada and others doing 4 months and something much more sustainable. And I don't think it should be off the table to provide debit cards. Again, that could be rechargeable later, that could be used, as you all know. A lot of our folks, if they want to order groceries and get it delivered, they can use that debit card to do that. And then also pull cash from it as well. And it's a very secured way, and we've used it again for food assistance. I know Senator Stabenow, who's a huge champion, y'all. Every call that I'm on with the Michigan delegation on SNAP benefits, she is constantly talking about food assistance expansion. I want folks to know, seeing those numbers of 6 million across the country, you may not have qualified for food assistance before. We're asking you to reevaluate and look, and I'll give you the information to how to do that, but you may qualify for food assistance now. And so we want folks to know that if your income has been decreased significantly because of this national pandemic, if you've lost hours, if you lost your job, things have changed significantly for you in your life, know that you may now qualify for SNAP assistance, or what we call food assistance. So we really want to encourage people to apply. For more information about any of those things, please go to, you can go to my website at tlaib.house.gov, tlaib.house.gov. There's a great toolkit there you can click on. It talks about different guidelines. And for folks that are listening, if you're like me, you're that person on your block that knows all the information and you want to share it. So when you're getting that information, make sure you're sharing it with your neighbors and others that might not have access to online resources. And also for folks to know, our office, my office, is fully still staffed. We may not be physically in. We're all teleworking, but we have been nonstop. I think we had 130 voicemails we got through yesterday. So we're responding to every single person. You can call the Neighborhood Service Center at 313-463-6220. Again, I'll repeat it, 313-463-6220. Again, one of the things I know, folks, it can be very intimidating, a lot of this. Know that when you all call me and you're saying, hey, I tried to do this, I tried to get in my unemployment, I tried to apply for paid sick leave, I tried to do all this, and I hit a bump, that is important to people like Senator Stabenow and I, because then we know that the administration might not be actually implementing it as it was intended by Congress. So that's when you all have to really come to us and let us know what are some of those hiccups and some of those challenges. I know I'm missing a lot of other things, but please know a fourth package is coming, and many of you are service-based organizations, but you're also advocacy organizations. Please speak very loudly about it having to be much more inclusive. A lot of the undocumented community, many of them who have tax ID numbers that pay taxes, are excluded. That impacts the children that we serve in our communities, especially in Southwest Detroit and other communities where on the east side, where we have a huge number of immigrant communities that are getting left out. And we want to, again, be looking through this lens as experts, as public health experts, and saying that we have to be as inclusive as possible and as aggressive as possible. But thank you all so much for this opportunity. I hope it was helpful. Thank you.
Thank you, Rashida. That was a tremendous amount of critical information. I'd like to let those that are listening know, again, you can submit your questions through the Facebook chat, or you can text them. You can text to 313-288-2082. Again, you can submit questions via the Facebook chat or text to 313-288-2082. So we're going to continue, and thank you. You've already done the segue up for Senator Stabenow. Senator.
Hello.
Hello, welcome.
It's great to be with you, and I want to thank all of you. You've done such a marvelous job of putting together people with such important information, and I want to thank my friend and colleague Rashida Tlaib as well for being on the line. But thank you to all of you. I'm so glad to hear you're going to be doing this on a weekly basis. This is really important. Let me just take a step back for a moment, and we're all giving a lot of important phone numbers and a lot of important information. I just want to offer as well that my Senate website, and you can just type in Senator Debbie Stabenow and the website will come up. We have everything that we have been able to get our hands on in terms of links and information about what's being talked about today. And I would mention that as Rashida and I have been, and our colleagues in Washington have been working, the way almost everything being talked about by other people sharing today involves federal funding. I mean, we are bringing in the dollars federally, fighting for Detroit, fighting for Michigan. Some of that comes through the state. Some of it comes directly to the city or to hospitals and so on. But our role is in a very big way right now is fighting for resources. And in this last package that I was very involved in negotiating, there were two goals that I felt were important. Number one is healthcare, right? We're not going to get past this unless we tackle this pandemic. And we know how really hard it is right now in so many ways to be having either staying home or being a critical worker that can't stay home. But the reality is that on the healthcare front, we've brought in significant more dollars for hospitals to purchase protective equipment. Now, being able to find it right now is the issue that we're all tackling, but our health centers are receiving more dollars. We're going to be rolling out actually some very, very positive new behavioral health centers that I've been working on for a long time to bring in more mental health and addiction services. That's a few weeks down the road, but that's actually coming as well. And so a whole range of things on healthcare. But the other piece really is about helping people be able to survive during this time. So if you are being told to stay home for 14 days, the good thing is if it's related to the virus, then as is already explained, there's up to 14 days paid sick time. One of the things that Rashida and I didn't like and we're trying to get fixed is there was a cap on the number of employees in a business that would apply to. And so I don't know why the folks wanted to put 500 employees when if you're working at Walmart or if you're working at Amazon or any other big employer, you have the same problem if you're not getting a paycheck because of having to stay home for 14 days. So that's an area that is a weakness in the law, but we never had any paid sick time before.
Right.
So this is the first step to be able to do that. And so, and the other provisions on paid leave and so on. But we also added this very expansive new benefit structure for unemployment benefits. Now, it's not up and running yet. I just checked in today again with the Michigan Unemployment Office. They're a few days away of being able to implement the changes that will expand who can receive help. They're also scrambling right now. We gave them resources to hire more people. They've got, they're hiring more people to answer the phones and to process the benefits. They said 90% of their staff right now is focused on processing benefits. But in a few days, and I would say just kind of, we need to pause for a moment and let them be able to get this together. But in a few days, we're going to see an expansion that covers more part-time workers, people who are self-employed, somebody who's maybe furloughed but not actually laid off. Maybe you're furloughed to keep your health care and couldn't get help. And so there's a whole group of people. And so we need to be really looking at that specifically. Rashida talked about the $1,200, and I am as focused as I totally agree with Rashida that I'm most concerned about people right now that haven't filed income taxes because they don't earn enough money to do that. And so this is an area that we all need to reach out on. Now, there's actually a form on the IRS website, a one-page form you can print off, and you could actually help somebody or give it to somebody to fill out that actually puts them in the system, even if they don't have income. And I think that's really important. That now, if somebody on Social Security doesn't have to do that, they're going to get the $1,200. And people who file taxes in 2018 or 2019 will in some way. We want it to be as fast as possible. But if someone hasn't filed, we want to help as many people as possible be able to file. And let me finally just say, there's so many things that were in this package, but there's a major focus on small businesses. You know, we have such strength in Detroit and all over the state on folks who've done fantastic small business operations, and we want to keep them going. And so there is, I think, something that we've not done before, which is we do loans, that's for sure, but we've structured it so that if you're a small business and you need a loan, there's also some grants available. But if you need a loan and you can keep your employees on the payroll for the next 8 weeks, the cost of doing that and the cost of the overhead for your small business will be written off the loan. In other words, it's a grant. So the whole focus we've had for medium and larger businesses too is you get help if people continue to get a paycheck. And I think that's an incredibly important piece of how we're trying to do this. So there's much more. I'm sure people have questions. I would just add just a couple of other things, which is there's money coming in directly to Detroit, something called Community Development Block Grants, which we've all used. And I know some of our presenters have been involved in those resources as well. There's at least 20 million more now coming in from this package to Detroit. And we have emergency grants to address critical issues related to the homeless or people who might become homeless. And Detroit will be receiving about $10.5 million to be able to help that as well. So I'm going to stop, and I'm going to just give one more shout out to the folks that are our new, really American heroes. And that's the folks that have to keep working. And that looks like a nurse, a doctor, the grocery store clerk, the mail person, the delivery person, the first responder. I mean, everybody who's still out there needing to work in order to help us stay safe. And we are thinking and praying and grateful for each of you.
Thank you so much, Senator. We do have questions. So I'm going to ask this question, and I think a couple of you can answer it. So the question is an individual eligible for FMLA if they are essential and able to telecommunicate if they are struggling with childcare issues due to the pandemic? Are they eligible for FMLA?
Well, let me just say, certainly let me chime in, but also indicate others on the call may be able to have more specifics. I think we're really trying to work through that right now. It depends on the employer. It depends on the size of the employer. You know, if I was just working with someone related to that who works for the state of Michigan, which is certainly an employer of more than 500 people. And so we were trying to brainstorm about different ways to come at this right now. So I think unfortunately, it's not clear. Really, the sick leave and paid medical leave was really geared towards private sector, people under 500 employees, but wasn't clear on essential workers. And so that's something, if we can help work through that in our office or others, I think it's going to take an individual approach.
Thank you, Senator. Aisha, did you want to add anything?
I would echo the same as Senator Debbie Stabenow. It is very unclear. I know someone else asked about that earlier. Essential workers is very unclear, but if they need to stay home for COVID-19 reasons, and it's specifically because they have to stay home because of their child, I think there is a way for them to be able to qualify, but it's still unclear. And that's something that we are working on at a national level as well.
Yeah, we get a lot of calls into our office, and one of the things I tell them is apply, like pursue.
Yes.
Because when you do, it tells Senator Stabenow and I where are the hiccups, where are some of the issues, because the more of you all seeking out this kind of help, so we can figure out again where that greatest need is. And I think will show that, hey, there's an increased number of folks in this sector that is dealing with this issue in a very unique way. Again, this is a pretty historic time, remarkable time. I think it's too positive to talk about it that way, but this is really uncharted territory for our country. So I think, again, to encourage folks, even those that are questioning whether or not they qualify for unemployment, to please just apply for food assistance, all these things. And again, a lot of these requirements have been waived. A lot of expansions have happened with these programs, and it's important to at least try.
Yes.
That's great. Thank you. Rashida, can you or the Senator or Aisha, will senior citizens be required to file a tax return in order to get a stimulus check if they did not previously file 1819 taxes?
So just so for folks to know, and I think the senator can also answer, if folks, and they know, if you get what they call that document from Social Security Administration, I always call it the little box with the pink boxes in there. Those folks, today we got some guidelines saying those folks will get checks. They are not required to file 2018 or previous taxes. It's the folks that get SSI or state disability or some of these other folks that are going to be left out. So it depends on what you're receiving now. If you're receiving a benefit from on the federal level for Social Security, then yes, and of course. But it's the other folks that might not be getting that yet, but are disabled and considered a senior that might be the ones who will have to fill out that form that Senator talked about.
And I would just jump in a little bit more, just again, because Congresswoman Tilley was exactly right. If you are getting Social Security, then you don't have to do that. But if you're in other related, either disability or, for instance, I've been asked, I get the home heating tax credit. Does that count? I'm filing for that. No, because that's a Michigan tax credit. And we're talking about
federal
system. And so there is a form. This is what I'm very worried about. I was on a conference call just a couple of days ago with our community action agencies, asking them to really reach out in every way with the folks that they're dealing with and print off that form on the IRS and see if we can help folks be able to fill it out. It's not hard. It's just that right now, because people are isolated,
right.
We aren't them. And so that is one of my biggest concerns about all of this, is that the folks who need it the most, who haven't filed because they don't have much income, aren't going to be able to receive it unless we can help them find a way to file.
And I want to just add one last thing. I'm sorry that we are concerned about our most vulnerable population, but this will go until the end of the year. And so while it is going to take a little time for everybody to be reached, it doesn't expire until December 31st. So I just want to add that as well.
Great, thank you. This is for Congresswoman Rashida Tlaib. What type of economic relief is there for undocumented people?
So it is a very challenging time. I can tell you for children who are U.S. citizens of undocumented parents, there is still relief for food assistance and so we're asking folks to still pursue help in that area. But if regarding direct stimulus, that's where they were excluded completely out. Even if you are a worker that is filing taxes, I know our neighbors, immigrant neighbors that file with what we call a tax ID number, billions of dollars every single year, they do not qualify for the direct stimulus, unfortunately. However, United We Dream, a number of community advocates, even yesterday at the Democratic caucus call, Speaker Pelosi and others have been in contact with advocates. There was a push by many of us to say, look, if folks are doing the right thing and filing for taxes and have an ITIN, a tax ID number, they should be able to qualify for relief, especially because this is a public health crisis. No matter what somebody's status is, we all deserve to be safe and healthy. And so just know that you have to continue to advocate. But that direct stimulus is not available, but the similar things that were available for children, like I know WIC, SNAP assistance, things like that. Please reach out to, a lot of my residents. I tell them, hey, the schools are still offering food assistance, meals. Reach out to the same nonprofits like Urban Neighborhood Initiative in your community that will be able to access at least your children to get services and help. Oh, and by the way, if you're undocumented, please know everyone gets access to testing. Everyone. Yep. Please remember that. And please know that your status will not matter. Please, there's been rumors out there that that's not true and people are going to get reported. Please know, and it's very, very important to know that testing is accessible to everyone in the United States right now.
Great. I want to add one go thing. Ahead. Just to reiterate or add to what Congresswoman Tlaib said, and that is, one of the very first things that I did with my agriculture and nutrition hat on was to reach out and make sure that our Detroit public schools and all our schools could get a waiver for the school meals funding so they could use it to give to children at home or to do in a different way. And so all children who are involved in the schools that were getting school meals, are going to be able, whether it's home delivery or each school's doing it differently, but those are the funds being used now to be able to make sure children can have access to food, which is still a challenge now, just in terms of delivering it for children.
Right. Thank you so much. Again, this is for Congresswoman Rashida. Do we need to provide account numbers for direct deposit, or is it taken automatically from previous years? If previous years, which ones?
So
that's the first question.
Yeah. So yesterday we just had a call to go through the IRS guidelines. And by the way, when the IRS guidelines came through, our chairman that was working on direct stimulus is very upset about this form now that people have to fill out, because that wasn't what I think was agreed upon before. But what it is if you file 2018, 2019 taxes and you have direct deposit there, they will use that information to get your check to you. A lot of people are very concerned about that because some are calling me and saying, hey, that is not and if that's the case, reach out to my office. We will get the information to the IRS. But I believe they're using the 2018, 2019 taxes and the information on there for direct deposit. And again, April 13th is where the first batch, I believe, will be going out via direct deposit or through mail, hopefully sooner than later. But they are using only those 2 tax years at this point and what the information you provide on those tax forms. And please know, and Senator Stabenow and I know this, many people, their income from 2019 is so drastically different right at this moment. And that's also very frustrating. We know that. Like 2020, it's like, how can you compare? You really lost all of your income, everything, and we know that. And trust me, at the fourth package, the more you all raise your voices, the more you all are advocating and saying, hey, you left out this sector of our community, you left out this sector of our community. I think the much more aggressive and more inclusive it will be next time. I hope that answers your question.
Yes, so there's one more question, and we need to move on to our next section. So the remaining questions, I actually have two more questions, and then the remaining questions we'll answer. But is there a government website to update the direct deposit account if is changing or it was overlooked in 2019? And then there's another question related to young people. Can youth who are working file for unemployment, specifically foster care youth that were emancipated? Can they apply for stimulus dollars?
I mean, Senator Stabenow, you can chime in here, but my gut feeling is if they have a Social Security number and they're a United States citizen, they should be able to apply for that form online. By the way, I looked on the IRS website. I'll make sure that the coalition gets the link to the form. We want to encourage that young person to please do fill out that form. If you didn't apply for 2018-19 taxes, that's okay. You can complete that form on the IRS website, which again, I'm looking for it. I just asked my team for it. I'll make sure that you all get it when it's available, and I'll put it on my website and my Facebook pages and so forth. But I would encourage that person to please apply directly.
And in addition, I would just add, as far as changing your direct deposit or your address, I'm encouraging people to go to the IRS website and do that, or try to do that. Now, I've been told that may mean it actually slows things down for you if you're changing an address or changing something. But I think it's important to try to update as much of that information as you can, so that it's going to the right place. And they, right now, as you can imagine, are overwhelmed, as they should be, with everyone that's talking to them and trying to get good information and so on. So it could take some time to do that. If you go on site in IRS and you're not able to get any kind of response at all, call my office, call Congresswoman Tlaib's office. We'll try to help on our end as well. But what we're hearing now is that they have been so overrun with the phones that they really want people to go through the website. And so I would urge you to try that, do the best you can, and let us know.
Great, thank you so much. Is Alexis Wiley still with us? So I think, and I'm just gonna say this publicly, we'd really like to verify the hours for the State Fair testing site. The Department of Health gave a 6 a.m. to 6:30 p.m. and it sounds like maybe there was a different number given. So if we can just make sure that we get that information and we post it, that would be great. Thank you so much, Senator Stabenow and Congresswoman Tlaib. We would love to have you guys back weekly if you're willing, because there are a lot of questions that folks have and they're still kind of rolling in, and some of them are really specific. But thank you both so much for being here. Jametta?
Yes, thank you. And also thank you for reinforcing the importance of having our legislators, because too often parents in our neighborhoods are not hearing your voice. And that's why we're so excited to have the breadth of community folks that are listening into these conversations. But when we talk about the community, one of the things that is foremost as well in people's minds, because we're talking parents, caregivers, grandparents raising children, is that we all know that just recently the governor has announced that in fact the schools are going to close for the remainder of the year. So we know there's a lot of things that we need to hear about, and there's still questions that we'll be trying to understand. Some of the things that the governor just announced was that each of the schools, the districts, will develop an alternative plan to assist students with learning over the closure period. Again, that's going to be left to the individual districts. All seniors will graduate and other students will be promoted, and all educators will be paid. To help us to talk about this and to learn more about it are two representatives, both from our charter schools as well as the Detroit Public School Community District. But to begin with, we're so pleased to have back with us is Dan Quisenberry, who is the Executive Director of the Michigan Association of Public Schools Academies. Dan.
Janetta, Christine, thank you again for doing this and putting this together. And even though we can't be in the same room, it's nice to see and hear from everybody.
Yeah.
So yes, Janetta, you set that up nicely. I'm speaking on behalf of the universities that authorize charter schools, the 55 charter schools that serve well over 34,000 Detroit kids. And you said it right, the governor's executive order, which she was just talking about around 11 or 11:30 today, I would turn that around, and you said it right, Jametta, but education's going to continue, but the school buildings are closed. And why I make that distinction is the schools around the city are important parts of their communities. They deliver food, as Senator Stabenow said, to their students. They provide emotional support. And we want education to continue as best that it can. So know that those schools that I represent anyways, and I know the traditional district that DPSCD is continuing to work to do that. We understand a couple things I want to point out to, and I want to make sure we have time for Q&A, but one is the technology and internet gaps that are in the city, or students that and families who may not have access to technology devices or internet. I want to tell you that the Detroit charter school community and other leaders, whether it's the district, the business community, authorizers, are assessing where those gaps are, looking for device supplies, looking for funding and ways to provide those. I would also say, I know there's a lot of, at least I'm most familiar with the charter schools in the city, already have that and have provided those opportunities to families. So just know that schools recognize that's an issue, and they're going to continue to work at closing those gaps. The last point I would want to highlight, and then looking forward to a good conversation here, is actually a question that was raised on last week's Town Hall that I think is really important. I just want to reemphasize. We understand that there's parents in the city and around the metro community that have literacy issues and maybe aren't equipped, whether it's their work schedules, the life circumstances this crisis has brought on, and or literacy issues that are just not well equipped to meet the educational needs of their kids as this stay-at-home order is requiring. So I want people to know that as hard as it might be, we would encourage you to share whatever barriers you have or that parents are having and experiencing with their schools. Schools are eager to hear, wanting to hear. They need to hear. Otherwise, it's really going to be hard to address those barriers. So please do reach out and communicate with your schools. If that's uncomfortable for some reason, then I'm sure, Jametta, that any of the organizations on this Town Hall would be willing to assist in some way, but please do reach out. Schools, as I've already said, are assessing their own gaps, trying to fill those, address them not only with devices and technology, but internet access. And then please do know, I'll make this last comment, educators, I've just been amazed at how they are pivoting so quickly. So like our healthcare providers, like our food delivery folks, I want to hold up our educators because they too are pivoting. And it's important that our kids continue in some way, that teachers who do want to teach and want to interact with their students are held up as well, because this is important for all of them as well, and they're working hard wherever they are. So thank you again for organizing this. I've got some ideas about lots of other questions that people may have. I'd really like to leave that to people to ask, and that we can address the things that are on their minds. So thank you.
Thank you. And thank you also for the invitation to organizations, many of whom are part of the coalition, that are absolutely engaging parents and will be sure to encourage them to be engaged, because educators, wonderful teachers and systems can't do this work of teaching and learning that our families need. But as we talk about that, and another very important and critical voice, obviously, is from the Detroit Public School Community District. And so we're so pleased that Crystal Wilson, the Director for Communications, is on board with us to share information from DPSED. Crystal. Crystal, are you with us?
Yes, can you hear me?
Yes, we can. Thank you.
Okay. It looks like my camera is stuck, but I'm not sure.
Oh, no, we hear you and we see you. Yeah.
Okay, perfect. I just want to thank the Senator Stabenow for your remarks and for State Rep Tlaib for your support and remarks, and for the more than 20 community organizations that are represented in the coalition for supporting Detroit Public Schools Community District during this unprecedented time. As you know, the district over the past 2.5 weeks have continued to serve our families and our students food, in addition to provide resources for our families through the enrichment academic packets. We will continue to do so, but in a more organized manner, as we heard from the governor today. Dr. Vitti, in a statement, a lengthy statement that can be found at DetroitK12.org, he thanked the governor for her leadership, and he thanks her for the support of public education across the state of Michigan. As you know, Dr. Vitti was one of the first leaders to call for schools closed due to the COVID crisis. And he made it quite clear that it was not because he didn't want our students to be educated or didn't think it was important, but out of the safety and concerns of their health as we see this virus ripping through not only our communities, but also our districts and their school communities. So in terms of next steps, so as you know, we received a 17-page executive order to cancel school this year as long as there was a threat. And what we've been doing over the past 2 weeks as a district staff and teachers, we've been keeping in touch with our families, and we've been devising a virtual learning platform for our families that will be both online and in a print form. We know that there is a huge digital divide and that everyone does not have access to technology. We are currently working with businesses and community members so that we can find a way to ensure that each family has internet access and a tablet or a laptop. So currently our plan, as you know, spring break was slated for April 6th through the 13th. So we will continue to serve food during the time that was slated for spring break. At this point, we will continue to most likely work through spring break to ensure that our virtual online plan is in place to launch on April the 14th. And from there, we will have some instructional videos and messages, robocalls, and texts leading up to that point to explain to parents and families and students on how they can access the resources, much like we've done in the past. And there will be teacher engagement. We will make sure we're taking care of the social and emotional support for our families because that's critical. And we will provide support for our students who have IEPs, as well as our students who are English language learners. We will provide enrichment in mathematics, reading, science, social studies, and we have also committed to providing resources in art and physical education so that our families can take advantage of as a well-rounded as possible enrichment experience. These items won't be graded, but they will be reviewed by the teachers and feedback will be provided so that it will be our effort to ensure that students reach proficiency in the content area and that the teacher is right there with the student working with them so that they can get the lesson and be ready to move on. In terms of our seniors, I know Dr. Vitti has a teletown hall this evening with students, but there's a lot of questions and there's going to be a lot of details that we're going to need to work out in terms of them. And I know some of the top questions are they going to graduate? According to the executive order, we will look at credits up until March 11th. And from there we will work to get the seniors the credit that they're missing as long as they were on pace to graduate. And that is the same with our students in other grades who are concerned about being promoted. Again, there's a lot of resources pertaining to DPSCD, particularly that's on detroitk12.org/COVID-19. It's a really long page, so go through the page. If you have a notebook, write down what you're seeking, because you may see something but write down what you're seeking and just click down to that page and see if what you're looking for can be found there. Otherwise, you can contact our help desk at area code 313-240-4377. I have enjoyed speaking to many of you through direct messages, whether it's on Twitter or Facebook, so you can continue to use those outlets to get your questions answered. I think I would be remiss representing Dr. Vitti if I didn't say thank you to our families and students who have stayed inside, and those of you who have been patient with us through our food service cycle, but it's just cooked in real time, like at the fast food restaurant. So we know sometimes the wait can be arduous, but hopefully the weather is reflective of what we see today and we can get better at that. We are working closely with the city of Detroit and the state of Michigan. There are still some questions that we as an organization cannot answer, but we will work through that. But lastly, I would say contact your school principal or either your teacher and ensure that your phone number is updated and that your home address is updated, as there is a possibility that we will be able to mail packets out to your home. I think my time is up, and I'm happy to answer any questions.
Crystal, thank you so very much. I'm probably we have over lots of questions that would keep you here for quite a while. But what I'm going to do is hand it to Christine if we've had any that have come in.
We do. So this question is for Dan. However, I think if I scroll down, it will also be for Crystal. But folks want to know what summer learning will look like. Do you have an answer to that yet?
Yeah, I'm happy to let Crystal take a stab at that too. And it will be the same for all of us according to the governor's order. She did speak to it in details, and yet the answers aren't going to be satisfying because basically it gives each district, so each charter school or DPSCD, the opportunity to address that however they think best meets the needs of their students. And then let's just, if I'll be really candid, everyone's working hard at meeting the here and the now needs. They're certainly thinking about summer. What does that mean? What does that look like? How will we meet those needs? But I'm going to guess a lot of schools have not yet really answered that question specifically. But they're empowered to do it. They're now been given some direction to do that. So more will be coming. And certainly I want to give everybody confidence that schools are thinking about it and they will be communicating with people as those decisions are made. Again, don't hesitate. Crystal said this too, and I would agree. Don't hesitate to reach out to your building where your kids attend.
Crystal, do you have anything to add to that?
I know before the governor issued the executive order today, Dr. Vitti did mention that we were considering some sort of summer enrichment. My hope would be that we would focus on our seniors to get them graduated and onto their college experience or career experience that they're looking forward to over into the fall, and to work with students where there may be a gap so that we can make sure that they get to the next level. But in terms of finite plans, we don't have those baked out just yet, but it is on the table.
Great. Crystal, this question is for you. If a person or a parent is not getting DPSCD robocalls, how can you be added to the call list, and are those calls bilingual?
Yes, those calls are can be set up bilingual. Because schools are closed, I would recommend that families contact the school building. We do have administrators who report to the building every day. That change has to be made at the building level. So they should contact their school and they should indicate what additional languages or the primary language it is that they need the robocall to be in, so that they can get in the calls and the text messages.
Great, thank you. So 2 last important questions, and is how are students going to enroll in kindergarten? And if you don't have the answer to that question, that's okay. And then I think this is coming from a couple of people. What resources are there going to be for special education students? And how will it affect special education students? So how will folks enroll in kindergarten, and what resources and how will the closures affect our special education students?
Right. So we're working right now. April 1st, we launched the Montessori enrollment application, the exam high school application, and the application school testing portal is now open online at DetroitK12.org. So to the extent that we can possibly keep continuity with families as the way things were done, that all of those services were all online. In terms of kindergarten, we will provide details. I would encourage you to go to DetroitK12.org and see if you can find that. I think it's under schools, and contact the school, or you can send me an email at communications@DetroitK12.org. I don't have the specific details regarding kindergarten enrollment, but we will be able to address that. In terms of students with IEPs, under the executive order, there are a couple of guidelines that the governor has outlined, but at this time, we will continue to provide education to those individuals and those families who have IEPs to the best that we can. And that could include occupational therapy and some of the other therapies, speech therapy that they were receiving, but we just need to figure out a way to do it so that it accommodates their specific need. So our intent is to continue to provide resources for our families with the current and existing IEP that's in place. We read the order and it looks like there will be no changes made to the IEP. So whatever that IEP indicated prior to the COVID is what we will adhere to moving forward.
Yeah.
Thank you. Dan, go ahead.
Yeah, thank you, Christine. Let me pivot and to follow what Crystal said, because we would totally agree, and she's absolutely correct. And it even aligns with what the federal government is saying. Schools need to do the best they can to meet the intention of the IEP, obviously with the barriers that staying at home, providing it at a distance like that provides. And then to just supplement what Crystal said, looking then to provide compensatory services after this is over, when we can get back in touch with students physically. Again, all that is not the ideal. We all need to understand that, remember that, and know that. And yet doing nothing wouldn't be acceptable either. So we're all going to do the best that we possibly can, and that's true. And then very similarly, go back to the enrollment question. Yeah, this is peak time that parents should be and would typically be looking at schools, whether they're kindergartners or maybe it's the 8th grader looking at a high school, et cetera, or someone moving into the community, if that's even happening right now too. Schools have different answers. Crystal spoke to what DPSCD is doing. We're working collaboratively with our schools to make sure that we get that information out to folks, because this just is different, obviously, and we want to make sure we're communicating with the community, the different organizations that are on this teletown hall, and providing that information to folks so that they're prepared.
Thank you both so much. There are more questions, and I know that I did not get to all of them. And I know that right now DPSCD and our charter schools also have a lot of questions that need to be answered, as you just received the order, I'm certain, just very recently, since it was just announced at 10:30. We need to wrap up. Hopefully you'll be able to join us next week again, Dan and Crystal, somebody from DPSCD. As we wrap up, I want to just, could Alexis, could you just confirm for us? I know you got back on the call. Thank you so much. Could you just confirm the time that the State Fair testing site is open?
Yes, it is open from, so we accept appointments. You're scheduled from 9 to 6 p.m. We will continue for anybody who's in line, but 9 to 6 p.m. are the appointment times. I think when the person from the health department was speaking, we started with initial earlier hours, but we shifted starting this past Wednesday.
Great. Thank you so much, Alexis. And thank you to all of our panelists for joining us today. And thank you for everyone that's watching for being with us today. If your question wasn't answered, we are committed to getting the answer and posting them next week on the COVID313.org website, as well as our partner organizations' websites. As we have reached our time, we're 2 minutes over, but we're doing better than we did last week. It's time to wrap up. Again, these town halls will be every Thursday from 12 to 2 to bring you the most up-to-date information. Please sign up for regular updates by filling out the form in the chat or by putting your email or telephone number in the chat on Facebook, or text it to 313-288-2082. Again, that number is 313-288-2082. And before we go, we're posting an evaluation, a short evaluation in the Facebook chat. Please take a minute to fill that out. We really want to do a good job here, and so that information is really important to us. We'd also love to hear what you want to talk about next week, what information you need, and what type of topics you have questions about. Please put those topics in the Facebook chat now, or you can text us what you're interested in at 313-288-2082. And there are two really key events that are happening today that we would love for you to join. I think these events will also help with some of the questions that you all have. The first is the town hall with Governor Whitmer tonight from 7 to 8. For the first time, Metro Detroit television stations are coming together to bring you this commercial-free event to provide viewers the opportunity to ask questions of Governor Whitmer in regards to the ongoing coronavirus pandemic. And then the town hall will be broadcasted Thursday, April 2nd. Again, it'll be broadcasted Thursday, today, April 2nd from 7 to 8 p.m. The special will be offered by all the stations and in Michigan in a partnership with the Michigan Association of Broadcasters and the Michigan Association of Public Broadcasters. We are so grateful that they've come together to work together to present that town hall. Also, we are going to be, 482 Forward and our young people are going to be hosting a live Instagram event with Dr. Vitti. That will be at 4 p.m. He will be taking live questions from Detroit students. Please visit the 482 Forward Instagram. We know that these times are hard right now, and it is important that we try to find strength in each other. As a community, we are here for you and each other. Thank you so much again for joining us today.
Thank you.
Thank you.
Yeah.